Over 100 years ago, the Spanish flu pandemic hit the world and caused a tremendous amount of devastation and loss of life. Though it has been long forgotten by many, the impact of this epidemic is still felt to this day. In order to better understand and appreciate the events that unfolded during the Spanish flu pandemic, in this episode of Liber-Tea, we'll take a closer look at its history, the mystery surrounding its origin, and how science ultimately provided its origin and its prevention. Be sure to subscribe, like, share, and comment on this and other episodes as we dig deeper into this troubling but impacting event in our world's history. In 1918, one of the deadliest pandemics in history swept across the world, claiming an estimated 50 million lives. The pandemic, known as the Spanish flu, was caused by the H1N1 influenza virus and affected people of all ages and backgrounds. It is believed to have originated in birds before jumping to humans in Europe and then spreading rapidly due to the movement of troops during World War I. The virus in question is the H1N1 strain of influenza, more commonly known as the Spanish flu. It swept across the globe between 1918 and 1919, infecting an estimated 500 million people, or 1/3 of the world's population at the time. The death toll was staggering, with some estimates putting it as high as 50 million. Despite its name, the Spanish flu did not actually originate in Spain, but rather got its name because Spain was one of the first countries that openly reported on the outbreak at the time. The lack of effective treatments and vaccines at the time made the pandemic particularly devastating, and it is still remembered as a tragic event in global history. The virus caused severe respiratory symptoms, including coughing, fever, and pneumonia, and was particularly lethal for young adults. In addition to the respiratory symptoms, the virus also caused a range of neurological symptoms, including seizures and confusion. The disease spread rapidly throughout communities, leading to the widespread panic and fear. In response, governments around the world implemented strict measures to control the outbreak, including quarantines and travel restrictions. Despite these efforts, however, the virus continued to claim countless lives, leaving a devastating impact on families and communities alike. The lack of medical knowledge and resources at the time, as well as the conditions of World War I, lasted a considerable amount of time, which contributed to the rapid spread of the disease. The first wave of the pandemic started in early 1918 and was relatively mild, but the second wave, which began in the fall of that year, was much more deadly. The second wave of the pandemic was caused by a mutated strain of the virus that was able to spread more easily and quickly than the first wave. It was also more lethal, causing severe respiratory distress and pneumonia in many of those infected. The high mortality rate was compounded by the fact that medical science had not yet developed effective treatments or vaccines for the disease. As a result, hospitals were overwhelmed and many people died at home without medical care. Despite these challenges, public health officials worked tirelessly to educate the public about ways to prevent the spread of the disease, such as wearing masks and avoiding large gatherings. Soldiers returning from the war helped to spread the disease across the globe, and many countries struggled to cope with the sheer number of sick and dying patients. Despite the best efforts of medical professionals, there was little that could be done to treat the illness, and the lack of effective vaccines and antiviral drugs made matters worse. In the end, the Spanish flu would claim more lives than the war itself, leaving a lasting impact on the world for years to come. Despite the severity of the Spanish flu, it did lead to significant advancements in public health research and preparedness for future pandemics. One of the most notable outcomes of the Spanish flu pandemic was the establishment of the World Health Organization, WHO, in 1948. The WHO's main objective is to improve global health and prevent outbreaks from turning into global pandemics. After the Spanish flu, the medical community recognized the importance of international cooperation and information sharing to combat infectious diseases, and the WHO works closely with governments, non-governmental organizations, and other stakeholders to identify emerging threats, develop effective strategies, and ensure that vaccines and treatments are distributed equitably around the world. In recent years, the WHO has played a key role in responding to outbreaks of Ebola, Zika, and COVID-19, highlighting the ongoing need for international cooperation in the face of global health challenges. Additionally, the pandemic prompted the development of more effective vaccines, antiviral drugs, and diagnostics. Researchers across the globe worked tirelessly to develop vaccines that could combat the virus effectively. The Pfizer-BioNTech and Moderna vaccines were among the first to be approved, and they proved to be highly effective in preventing COVID-19. These mRNA-based vaccines were a game-changer for vaccine development, as they could be rapidly designed and produced in large quantities. Apart from vaccines, antiviral drugs were developed that could reduce the severity of symptoms and hospitalization time. Diagnostic tests and rapid antigen tests were also developed to detect SARS-CoV-2 quickly and accurately. With these developments, the world became better equipped to handle not just this pandemic, but also future pandemics that may arise. So the next question on everyone's mind is, does the Spanish flu still exist today? The Spanish flu, also known as the H1N1 influenza virus, is no longer a pandemic-level threat. However, it does still exist today in a much milder form. In fact, the seasonal flu that affects millions of people every year is actually a descendant of the Spanish flu. While it is not as deadly as it was during the 1918 pandemic, it is still important to get vaccinated each year to protect against the flu and its potential complications. The flu, also known as influenza, is a highly contagious respiratory illness caused by influenza viruses. While most people recover from the flu without any issues, it can lead to serious complications in vulnerable populations, such as young children, elderly individuals, and those with weakened immune systems. In addition to getting vaccinated, there are other steps you can take to reduce your risk of getting the flu, such as washing your hands frequently, avoiding close contact with sick individuals, and staying home if you are feeling ill. Remember, prevention is key when it comes to protecting yourself and others from the flu. Today, the lessons learned from the Spanish flu continue to inform public health policy and research efforts aimed at preventing and mitigating the impact of future pandemics. One of the key lessons learned from the Spanish flu is the importance of early detection and rapid response. In today's interconnected world, diseases can spread quickly and easily, making it crucial to identify outbreaks as soon as possible in order to contain them. This requires strong surveillance systems and effective communication between local, national, and international health authorities. Another lesson is the need for robust healthcare infrastructure and resources to support large-scale public health interventions. This includes having adequate supplies of personal protective equipment, diagnostic tools, and medications, as well as trained healthcare workers who can respond to emergencies. Finally, the Spanish flu taught us the importance of community engagement and education in promoting public health. By working together to raise awareness about disease prevention and control, we can help reduce the impact of future pandemics and protect the health of our communities. Thank you for joining in on this episode of Liber-Tea, where we once again see that learning and knowing history can help us greatly to develop, protect, and grow our future. Please be sure to like, subscribe, share, and comment on what strikes you in this episode, and always share your requests on future episodes you would like to hear from us. Thank you.